People across the country are struggling with high health care costs, and we're shedding light on this nationwide crisis in our series, Money versus Medicine. In this next story, a woman claims she was tricked into buying a skimpy health insurance plan that left her in massive debt after a devastating injury. Take a look at this.
It wasn't until Trish slipped on a sidewalk and broke her back and wrist that she found out the health insurance she purchased a few months before wasn't much help, and she was left with $36,000 in hospital bills. Trish thought she purchased a comprehensive health insurance plan through the government-regulated Affordable Care Act, but claims she really had visited a website that was made to look like it was part of the ACA portal. She entered her information and was contacted by an insurance broker who she says told her the plan was a PPO and that her doctors were in network. But what she was really sold was a limited benefit insurance plan. When she tried to reach the broker, his number was disconnected. So when it comes to health insurance, how do you know what you're really buying?
Well, Trish is joining us today via Skype. Also joining us today via Skype is surgeon, advocate for transparency in medicine, and author of The Price We Pay, Dr. Marty Makary. Welcome to you both. All right, Trish, let's get started. Tell us about these bills that you incurred and, in fact, how much your insurance company was willing to pay.
It was December, and I'd fallen on some ice, and I broke my wrist in 3 places and my vertebrae in one. And they covered the urgent care, and then the first doctor's visit or two, I needed surgery for the vertebrae. And I got a call from the doctor's office that said, I don't have coverage for surgery, any surgery. So I said, that can't be right. And I called the company for the number that's on the back of the card, and they said, you're right, you don't have coverage for any surgery. And they were pretty much done.
So Dr. Makary, how common is this, that someone would buy a plan and they would misrepresent what was actually covered?
Now, most plans are supposed to abide by a basic standard, but you've got to be careful when you buy health insurance. You're often buying them through intermediaries who are getting paid on the back end. For example, the 4% commission, that's a big commission. It's not like real estate where they get it one time when you buy a house, they get it for life. So if you spend $10,000 a year on health insurance, $400 a year of your money is going to that broker for life every year. People need to know about the money games, and that's why we need basic healthcare literacy.